doing a PowerPoint presentation on drugs for erectile dysfunction and benign prostatic hyperplasia. Erectile dysfunction is also known as impotence and defined by Lehine as a persistent inability to achieve or sustain an erection suitable for satisfactory sexual performance. In the U.S., ED affects up to 30 million men. It accounts for 525,000 physician visits each year, and it's commonly associated with chronic illnesses such as diabetes, hypertension, and depression. Some drugs to treat ED. Viagra was the first oral treatment for ED. It's reliable and easy to use. Some benefits derived from enhancing the natural response for sexual stimuli. It doesn't cause erection easily. It can be dangerous for men taking certain vasodilators, especially alpha-adrenic beta blockers and nitroglycerin and other nitrates used for angina. It's also used to treat pulmonary arterial hypertension. Some possible causes for erectile dysfunction. Cause may be disease or drug-related. Men with diabetes, the incidence of ED is between 35 to 75%. The risk of ED increases with advancing age. Mechanism of action of Viagra. Selective inhibition of PDE5. By doing so, it increases and preserves the cGMP levels in the penis, thereby making the erection harder and more longer lasting. The drug only enhances a normal erectile response to sexual stimuli, erotic imagery, fantasies, and physical contact. So in the absence of stimuli, nothing happens. Pharmacokinetics. Viagra is well absorbed following oral administration. Plasma levels peak about an hour after dosing. A high-fat meal slows absorption, so as a result, plasma levels peak in about 2 hours rather than an hour. It's metabolized by the liver in the P450 system, eliminated primarily in the feces, 80%, urine 13%. Half-life is 4 hours. Clearance is delayed in men over the age of 65 or with hepatic impairment or severe renal insufficiency. Causing drugs to rise to higher levels or persist longer in the body. Sexual benefits of Viagra. Men with ED. Some improvement in erection, hardness, and duration was seen in 70% of men taking this drug, compared with 20% taking the placebo. Benefits were dose-related and persisted up to 4 hours, although they began to fade after 2 hours. It's beneficial to patients with a variety of diseases such as diabetes, spinal cord injury, transurethral prostate resection, and ED of unknown origin or cause. Sexual benefits continued. In men without ED, Viagra has little or no effect on erection quality or duration in men who do not have ED. The result in a healthy man a placebo response. In women, Viagra is not approved for women, and it's failed to show much enhancement of sexual arousal. Adverse effects. Hypertension can produce a small reduction in blood pressure. In men taking nitrates or alpha blockers, severe hypotension can develop. Priapism. Painful erection lasting more than 6 hours. If an erection lasts more than 4 hours, seek immediate medical attention. Untreated priapism can damage penile tissue, causing permanent loss of potency. Persistent erection can be relieved by aspirating blood from the corpus cavernosum, followed by irrigation with a vasoconstrictor such as epinephrine. NAION, non-arteritic ischemic optic neuropathy, can result in irreversible blurring or loss of vision. This is caused by blockage of blood flow to the optic nerve, and patients that have this should not be taking Viagra. Sudden hearing loss is a rare side effect. It's usually in 1 year, and it's associated with dizziness, vertigo, and tinnitus, and this can be partial or complete. Other adverse effects that are most common adverse effects include headache, flushing, dyspepsia, nasal congestion, diarrhea, mild transient visual disturbances, only 3% of cases, blue tinge to vision, and increased sensitivity to light. Drug interactions. Nitrates. Viagra and nitrates promote hypotension by increasing CGMP. If both of these drugs are taken together, combined life-threatening hypotension could result. So therefore these two are contraindicated. Alpha blockers. Alpha antagonists, including Cadora, are used for prostatic hypertrophy, dilate arterioles, and can lower blood pressure. Combined with Viagra can cause symptomatic postural hypertension. Combination should be used with caution. Inhibitors of CYP3A4, such as erythromycin, they can suppress metabolism of Viagra, therefore increasing the levels. And these combinations should be used with caution as well. Preparations, dosage, and administration. Viagra is available in 25, 50, and 100 milligram tablets. The usual dose is 50 milligrams taken an hour before sexual activity. The dose range is 25 to 100 milligrams 30 minutes to 4 hours before sexual activity. Low dose 25 milligrams should be used in men over the age of 65, men with hepatic dysfunction, severe renal impairment, or men taking alpha blocker drugs that inhibit the CYP3A4. Other PDE5 inhibitors are Levitra and Cialis. Levitra is unique in that it prolongs the QT interval, and it was the second medication approved for erectile